Okay, welcome everyone online and those in the audience. This is our bi-monthly health district board meeting. Today is Friday, April 19th. This time I will go for roll call. Dr. Cole, are you online? Don't see anybody there. Dr. Furch? Here. Dr. Young?
Here.
Commissioner Tucker?
Here.
Betty Ann Nettleton?
Here.
Commissioner Rogers?
Here.
Okay, got all that. So we'll see if maybe Dr. Cole doesn't show up here in a bit. Before we move on, I'd like folks on the side to introduce. Please stand up and introduce yourself to the rest of us.
Maria Ortega, Marketing and Communications here at CDH.
Curtis Loveless, Division Administrator for Community and Environmental Health.
Rachel Grubb, Business Analyst with the State Controller's Office.
Jackie McLeod, State Social Security Manager with the State Controller's Office.
All right, thank you very much. Everyone has had a chance to look at the agenda. If there's no additions or corrections, I'd entertain a motion to approve.
So moved.
Got a second?
I'll second.
Got a motion and a second to approve the agenda as presented. All in favor, please say aye.
Aye.
Those opposed? Motion carries. Okay, our next agenda item is an action item as well. This is the vote on the March 22nd Board of Health meeting minutes. Everybody get a chance to read those? If no additions or corrections, I'd entertain a motion to approve those. A second.
Second.
Got a motion to second to approve the March 22nd Board of Health meeting minutes. All in favor, please say aye.
Aye.
Those opposed? Motion is approved. Okay, our next agenda item is also an action item. This is a discussion and a vote on the purchasing of medical van unit. And I think the last time we talked about this, we had an option to go look at a larger unit at St. Luke's. I guess we were waiting to see how that was still available, or so I'm going to turn it over to Dr. Furch if he found anything else out.
Well, currently the update is it is still available. It's been run up the flagpole. I don't know if Russ has heard anything in the last couple of days since he and I messaged, but apparently the wheels of bureaucracy might move a little bit slowly, but it is being evaluated by their finance and legal team. It appears that some of the money that was used to purchase it was COVID money, and there's some pretty strict rules about the disposition of COVID money. And I think that's my understanding is where their legal department is sorting out where they can go with it. It does appear that their attempt to return it or sell it or trade it to Dennis Dillon, I believe is where they purchased it, wasn't fruitful for them. And so my recommendation, I would be uncomfortable in moving forward on something else until the door to this opportunity is solidly closed.
So this was coronavirus money, so there's probably no restrictions. And like the opioid funds, there's a lot of restrictions on those. And if they audit you and found out you didn't spend it right, they're going to ask for it back. So we got to be kind of careful on this one. I guess my question to the board is, how long do we want to wait? How does everybody feel about this?
Some additional information to
Okay,
present on this too.
sure, go ahead.
So just wanted to give a little bit of a background kind of on how we got to where we are right now. So last August, we were approved of $100,000 in our special projects with carryover designation from fiscal year 24 to be dedicated to purchase of a van. At that time, we did a little bit of this background last time too, but at that time, I think some of you suggested that probably wasn't going to be enough for the purchase of a medical van that was fully fitted out to what our needs were going to be. So we talked about potentially looking at increasing that funding once we got some quotes. So we did go out locally, talk to some dealers, got some informal quotes and discussions locally, and then decided to move to 3 formal quotes, which we got. They were all around the $200,000 mark for any of them that would have been fully fit and met our needs. So over the last month, what we have been working on here is talking to staff and putting together some of the benefits and drawbacks to a Class A motorhome versus the van size and how we would be able to utilize one or the other. So for a Class A motorhome, we know with that van specific or with that motorhome specifically, potential that it could be cheaper than the van. Also does provide additional space, which could be a big benefit. Some of the drawbacks on it are that parking and transportation of it are significantly more difficult. There would be some additional training required for our staff, balancing it, how to manage the black water tank. Some staff that we spoke with were uncomfortable with the larger size of it, said that they would not be comfortable driving it at all, even with some practice. Currently, when we have serve safe classes or when our facility is fully utilized, we already have limited parking space, so we don't at this time have a dedicated space where we could park a Class A motorhome. Not that we couldn't readjust or figure out how to make that work, but with the way the parking lot's laid out now on a day when we're full, we don't have space to accommodate that. The other thing to keep in mind with that are that we know that we need some upgrades. We need to rewrap it. We need to make the ramp ADA compliant. We're not sure what the status. We know it's low mileage. We don't know what shape the motor's in. So at just very first blush, there would be at least tens of thousands of dollars worth of upgrades that would be required to it. Did a little bit of research on wraps and making the ramp compliant. Both of those individually appeared to be in the range of 10 to 15K, depending on, very informal. There could be some differences in that. So each one of those upgrade items would probably be somewhat significant cost, in addition to not knowing what the cost of the motorhome is to start with at this point. And then in talking about the van, some benefits of that, easy to move to multiple spots in a single day. The smaller size does provide enough space for the required activities. Again, if we want to expand, it may be too small at some point. Staff that we spoke with are comfortable today driving a vehicle of that size. And as a reminder, that has gray water tanks. It does have the hand washing station, but not the black water tank. Drawbacks to the Sprinter van or ProMaster are that it may be significantly more than what the motorhome would be. And it may not meet all of our program needs in the long term. So I think at this point, the staff recommendation, CDH recommendation would be to proceed with the van purchase with the option to keep working with St. Luke's and potentially acquire 2 vehicles to be providing mobile services in the long term. We wouldn't close that door completely. The reasoning behind that, some of what I've just gone over, but we expect to continue to grow our mobile services, not shrink them. Proceeding with the van purchase does not prevent us from expanding our mobile capabilities with additional vehicles in the future. The cost of the van is covered by an approved special project fund that's already been set aside, and the additional is through salary savings. So we're not asking for additional taxpayer money or additional district funds to be dedicated to it at this point. It is with existing funds and funds that were dedicated for this purpose. So just to have the full information and from our perspective and what we've been looking at over the last month, I wanted to provide that for the discussion and to let you to proceed in decision making.
Couple of questions, Laurel, that I hear. You said to wrap it and put in an AD, is that 10 to 15,000 each?
Yeah, wrap. So wrap of the van size is 10,000 by itself. So I this is a guess, but I'm thinking that if we wrap a full motorhome would probably be a couple grand more than that.
Welcome, Dr. Cole.
Thanks, I got my flight bump back, so I can make it.
Good. And then I forgot your answer. Is it a 4-wheel drive or is it a 2-wheel drive? The van.
I believe it's 4-wheel drive. I did not write that in my notes. Okay, let me see if it's in the specification.
The reason I asked that, because in Valley County, and I'm sure probably sometimes in your guys.
Yeah, I thought the
That's
Sprinter
kind of
would
important.
over hill.
I thought it was.
I think it's
more brand
appropriate.
new.
They generally are the sprinters.
I don't have it listed on the specs.
Okay, any more comments? What's your pleasure?
Well, a couple of thoughts from my perspective. I personally fail to see the utility of wrapping it. I don't think that should be a foregone conclusion. If you look at what St. Luke's was able to do, they threw a stencil on the driver's door and the passenger door for a few bucks, and then they had a bit of a stenciling on the tailgate end of it that just simply said St. Luke's. I
We did the magnets for my business,
Yeah.
like $40.
I don't, we're not advertising, products or, I mean, I fail to see the utility in that. So I think that could be an expense removed from the conversation. The ADA nature of the handicap ramp or not, I don't know exactly what that might look like. St. Luke's used it for a mobile shot clinic, and in their description, they talked about it having the ramp. Now, yes, with ADA, there's certain grade issues and possibly a railing that might need to be installed on the side. I can't conceive that would be an enormous expense. And if I recall what the fleet manager said, it also operates as an elevator. So it comes down flat and it creates like a patio area, and it could be elevated, and that might be compliant with ADA needs. And my inclination would be, this is an opportunity before us right now. And if we could acquire this and test the concept, granted, yes, maybe it's a little challenging for some, given the cost comparisons, there's dump stations all over, and a periodic, trip to a dump station probably isn't that inconvenient for someone that is willing to drive it. The cost, I maybe even envisioned Dennis Dillon, and I'm throwing things out there without talking to the individuals involved, but Dennis Dillon originally sold the motorhome apparently, and there might be an opportunity for some training classes, utilization classes, how to operate the dump station. And if we're in a remote area, having an actual lab in addition to just a gray water sink might actually be important.
Yes.
In an emergent situation, we immensely increase the utility of the vehicle by having the full bathroom facilities for workers that might be at a shop clinic all day without having to make arrangements and travel or go to a park bathroom somewhere or whatnot. My inclination still, despite the good work here, would be to pause a moment and take advantage of the opportunity before us, see what kind of utility and use arrangement we can possibly make, what utility we could get out of this, and then venture down, if need be, the additional vehicle. But to spend $250,000 of taxpayer money, whether or not it was budgeted or appropriated or saved from somewhere else, frankly, just because we have it doesn't necessarily mean we ought to spend it, in my opinion. We could always find another purpose for it, just like we redirected, 100-some thousand last month from the payroll savings. That could be directed to something should we not need to spend it on a vehicle. So I would make the motion that we pause the decision until we can iron out some further conversation with St. Luke's and see if we can't make this a win-win for everybody, the taxpayers and the, users of Central District Health Services and see where that option goes first.
Okay, we have a motion on the floor. Do we have a second? You have a motion and a second. To pause it, I'm wondering if you could amend your motion to a certain time, our next meeting or.
That I would say the next regular meeting, I did become aware of another contact at St. Luke's. Are you familiar with Jeff Seelick?
Yeah.
Okay. I was made aware that he might be someone to talk to this morning, as a matter of fact. And maybe if you would willing, but yes, maybe to the next regular meeting, not next week's special meeting.
Is anybody from on staff when you looked at the St. Luke's vehicle?
No, we've had no contact from St. Luke's.
And that, I asked for those internal pictures and I was promised those a number of times. But I fully intend on either arranging a viewing or, maybe through the office, we can arrange a viewing or at least get the internal pictures. But my understanding, and in my peeking through the window, it had the Sharps containers mounted, it had the grab bars with the ADA, some version of ADA compliance within the vehicle itself. It just, from that verbal description and what I could see through the front window, it appears that it could really serve the need or the conversation that we've been talking about. Yes, fully understanding that it is big and there might be some folks that are concerned about driving it.
Well, and that's the other part, and I know I have a motion on the floor and we're in a discussion right now, but I think there's some other things that we need to consider, and perhaps Laurel, that you could work on some of this, but let's compare the cost to insure it. I think we need to look at the mileage, the gas mileage, because everybody knows fuel's going back up versus a van. I don't know what kind of mileage these smaller vans get, but I just know over the years in county government it's not the cost of the vehicle, it's the long-term maintenance and actually operating the vehicle that's where the real money gets pretty high. I think that it's important that we get a vehicle that everyone is comfortable to drive. And honestly, it would freak me out if I had to go out and learn how to drive this thing to a call in the middle of January, February, or tough weather. And being a new driver, that would be pretty scary for me as well. So I think we need to not necessarily look at gift horse in the mouth, but it may in the long term not work. So we got to make sure that the vehicle, whatever we get, is going to work for us without a lot of long-term expense. So we got a motion and a second to table this. Could you amend your motion till May 10th, which is our next meeting?
Yes, I'll amend or remake my motion to postpone this to the May 10th meeting. Postpone the decision on the van to the May 10th.
Jane, go ahead.
I don't know if this is the correct time in terms of discussion, but
Yeah.
can we have somebody go look at it from the staff and have a timeline as to when we might know what they're asking or if it's possible or whatever so even when we get together on the 10th, we've got some idea. We can make some choices.
Well, and I think that's a great option. Let's go look at it. Even though we haven't made a deal yet, take some of those folks that are possibly going to be driving this and spend a couple hours and go look at this thing and look it over and kind of see. To me, like I said, it's like buying a new combine or a big giant tractor. I want to make sure I know how to drive the thing and I feel comfortable before I'm going to spend that kind of money. But it really comes down to the deal. If they're going to gift it to us or they're going to want 200,000 for it, then that really makes a lot of my decision.
That makes the decision quickly.
Yeah. Video.
Having dealt with sick people, and this is going to be a medical van, I think that is absolutely imperative we have full bathroom facilities. Absolutely.
Especially if you get a reaction.
Absolutely. You have somebody come in vomiting, somebody with diarrhea. You've got to have full bathroom.
That's a good point. Okay, so we got a motion second to
One
table.
more real quick question.
Oh, sorry.
No, not a problem. Does anybody know how long our quote on the fan is good for?
That's my concern is they're gonna pull the quote.
Yeah.
I think we may already be past that threshold, but we can get a new one, hopefully before the next meeting on that as well.
Okay.
And maybe in light of the fact that they might lose a sale, maybe we can work the quote down.
Yeah.
You know, hey, sorry, we've got another option. Can you do better?
Well, and I think you make a great point that this is taxpayer dollars, whether we saved it from last year, whatever. So it's still all taxpayer dollars. We've got to make sure that what we get is the best deal, but it's also one that the staff is comfortable actually using. I can understand climbing into one of these things, and trying to learn how to drive it first time. Be challenging, okay? So we got a motion and a second to table this issue until May 10th. All in favor, please say aye.
I,
Any opposed? Motion carried. So this would be tabled on May 10th. Yeah, I know we're way ahead of schedule as far as the clock, but I'm gonna keep right on going today. The next agenda item is an action item. This is to review and vote on the FY 25-12 budget, which should be in your packet. And I don't know, Russ or Laura, if you want to go through this, kind of looking at where the big jumps are and where they're drops, may help. The first page is really the best page to kind of look at and see where we were and where it's going.
I'm going to present the budget and process and kind of the next steps, which will final step is May 10th, where we have the budget committee meeting in Valley County at our office. So this is the proposed budget. This was built on the guidance that you provided at the March meeting, which was to do a 3% increase from our counties. And I'll walk through what that looks like for each county. And then to build in paying for our staff, which I'll talk about as well. Most everything else in the budget's money coming in, money going out. Those are the two big areas that I think are really important for the board to weigh in on. So page 1 is the summary, and I'll walk through each of these and what you just described, Commissioner Hasbrook, the major changes. So you can see our budget has continued to grow. I actually brought an old budget just to talk about market values to provide some fairly recent historical perspective on how things have changed in our district. But our budget now is $18 million. That's expenditures, and then we have the revenue, including the 3% increase from our counties. That will allow us to have a balanced budget. Again, I'll go through the details of each of these specific areas. If you turn to page 2, what you'll see there is the what the 3% increase looks like compared to last year. Counties in the box. It's 160,500 in total. And there's a formula in Idaho Code 39-424, which makes the decision on what each county would pay. And it's based on 30% market value and 70% based on population. So you'll notice there in the last 3 columns within that box, you'll see that Ada County with a 3% increase would only see a 2.3% increase in their share. And I will point out that that's never happened in my coming up on 19 years. Ada County makes up such a large share, close to 90%. When you do a 3% increase, they've always been 3%, 2.9, or 3.1. And on the next page, you'll see why that occurred. There's obviously that difference has to be made up somewhere. So you see in Boise County, it'd be an 8.6% increase, $7,901. Elmore County would be a 4.4% increase of 10,319. That's the amount of the increase, not the total amount. The total amount's in the green column. And then Valley County would see the largest
Yeah, I think so.
percent increase of
I think so.
31,121. And you'll see in the footnotes there, this is data that we get from the Idaho State Tax Commission from the 2023 net taxable value. And then the population numbers come from the US Census Bureau, but they're estimates between the actual census every 10 years. And I know Betty Ann, when we talked in the past, there's been Elmore County had shown it's going down and there's lots of building going on. So I'm not sure exactly how accurate these are, but this is what the best we have to go on, and it's what we've used consistently and all the health districts use this for the formula purpose. If you turn to page 3, that's where you'll see why the distribution is as it is, with the Ada County seeing a lower percent contribution. Is market values have actually decreased in Ada County, according to the tax commission. Valley County, on the other end, has gone up over $1 billion. So, or 10% increase from what it was the year prior. So while that's only 30% of the formula, it's a big enough shift that it causes the distribution I described on the page prior. Just for historical purposes, I pulled my budget out from, that was the FY 2014 budget using December 2012 data. Market values in Ada County and as of December 2012 was 24 billion, and Valley County was 2.7 billion. And I know you'll probably remember, and all of us will, as the kind of the run up to the housing recession, Valley County's market value was over $5 billion. So it got cut almost in half in that period of time.
And that's a really tough thing to deal with, because you have to tax people over value to get the same budget. People really kick and scream about that.
Right.
So there's kind of, to me, there's a combination there where you've got to show some cost savings, whether that's RIF or deleting some programs, and kind of slow that tax increase down. Kind of a middle ground, so to speak. You got to cut some, you got to ask for more to make this process work.
It's not realized income, it's just imaginary income based on it.
So the population change also is probably about as low as we've seen it in a long time. We're always at least 2%, and some of our counties are obviously, just like Boise County, still growing at a pretty fast rate relative to the other counties within our health district.
Elmore County's growing pretty fast.
And I don't think those are real numbers either.
A lot more folks there.
So, when the vote occurs, I'm going to be asking for your approval of this proposed budget, but it's still going to be a proposed budget until the chairs or their designee get together on May 10th for the budget hearing in Valley County. So this is just the first step with budget guidance, second step getting approval from you all, and then the third step is having the budget committee. So that's out of the board's hands, and it's in the hands of the counties themselves. And then once they approve it, that sets our budget starting July 1 of this year.
Question.
Yeah.
This formula, the market versus and population, is in Idaho code, right?
39.
We don't have any way to change that.
No.
Yeah.
No, and it's been a discussion point that comes up, I would say, about every year with our counties. And I provide the same response as always. It's not something that, our board or administration can influence, and encourage county commissioners that have raised concerns. They'll have to work with an organization like the Idaho Association of Counties and the legislature if they want to make a change to that. But anytime you would make a change, you're going to have potentially a big shift. And around the state, historically, it's been the urban counties that want to make a change to it, which would put the burden on the rural counties. And there's a few more rural counties in Idaho than there are urban counties, so I'm not sure that that'll ever fly. But it comes up.
It does come up, and I think it's interesting how the forefathers in the formation of this put an urban with a bunch of rural counties in each district. I think that was a smart move, honestly, but sometimes the urban counties don't feel that way, but I think that was still a smart way to do it.
And I think what you see with the public health district structure, which is not commonly used throughout the United States, is it allows our rural counties to get technical expertise that they otherwise couldn't really afford. You know, you couldn't necessarily, like in Boise County, pay for a full-time environmental health specialist. Then what do you do about the registered dietitians and the nurse practitioners, the clinical assistants and the health educators? And it's not that you couldn't pay for those services individually, it'd just be pretty hard to acquire. And I think Betty Ann has attended some of the national conferences, and I think Idaho is looked at as a pretty darn good model, especially for states with a lot of rural communities. So on page 4, you'll see this is not the detail, that's at the very end of the document, but the specific areas. So personnel cost, there's a decrease in personnel cost, even though we were able to build in a 3.5% increase for our achieves performers and a 5.5% increase for our high performers. And Gary put this here to talk a little bit about that, or really, I guess, answer questions you might have with the document that was also included in your packet. What we've tried to do is keep in check with what our counties are doing, not to get too far out ahead of them or too far behind. We also look at what the state of Idaho does in total. As you know, all the main offices for the state agencies are located in Boise, and they're a competitor of ours for our staff. You have like Department of Environmental Quality and the Division of Public Health in particular, Office of Drug Policy and some others. So I wanted to make sure that you see that, and you can see the averages. And the averages are not easy to determine, and that's why Gary's here, because I would necessarily be able to do that as well as he could, because you can see there's one-time funding, there's bonuses, there's wide ranges of merits, and the things that when there is a wide range, I know Gary will get from the counties pretty much the whole list. So if you have 100 employees and what the salary increases are, and divide that by the number of employees, versus trying to parse out what was that true average. So I think it's pretty accurate, but if you want to, I pause.
Yeah, well, welcome, Gary. Thank you. I guess my one question is the fringe benefits that went up 430, is that mostly medical insurance?
I'm sorry, the what now?
The 430,000 for fringe benefit that went up.
I think Laurel will answer that.
That's a decrease. That's where the primary decrease came from. Decrease in fringe benefits, slight increase in salaries, decrease in fringe benefits.
So the pay went up, but the fringe benefits actually dropped. Is that due to less employees?
Yes, less employees. We are reducing by about 5 FTEs total for this year. And then we also have a shift in insurance providers that's saving us about $80,000 per year. So combination of slight reduction of staff, reduction in cost, employer cost of insurance benefits, and was an overall reduction of the fringe benefits.
So we switched over to another insurance carrier?
The state did, actually. So we follow the Office of Group Insurance.
That's right.
Yep. And so they switched from, they went out for competitive bid. They were with Blue Cross. They went over to Regents Blue Shield. And so that ended up in a net savings for us of about $80,000 for all of our staff. The nice thing for the staff is that it didn't increase Like when you look at the PPO policies, they're exactly the same, which is by far the most popular choice. There was some variances in some of the others, but it was minimal. Some savings on like the high deductible plans, they went down some. The traditional plans had a little bit of variances in there, but overall, the employees, it's a benefit for them.
Yeah, but yeah,
Gary, as I understood, the state was, we were only given two options, Blue Cross and Blue Shield, right?
So the state has, I'm sorry, Mr. Chair.
no, go ahead.
The state has one carrier that we use for all of our state employees. We were with Blue Cross before. The bid went out and Regions Blue Shield won the bid. So we are switching it as of July 1st. All of our staff will switch over to Regions Blue Shield.
Like the gym plan and everything could not be considered.
That is correct, because we're not part of a county entity.
Well, and that's always been the biggest cost to the counties is medical insurance. And so when you come back with employees with only a 3% and they're discouraged, I have to remind them that yes, but your premium went up 8, 9, 10, 11% last year. And we're covering that increase. So that's really more salary too. And to remind folks that it's not just salary, there's benefits as well. You guys have HSAs and all that stuff. Is that an option?
We do. We have an HSA that is attached to a high deductible plan. And then if you had a traditional or PPO plan, then you can go with the FSA.
Yeah.
But I think maybe Betty Ann, if I'm getting your question right, the state had other options for bidding, like Mountain Health Co-op and other true insurance companies, didn't they? Are you aware?
I don't handle any of the bidding. I'm sorry.
I believe there were other options and that it was Regions Blue Shield that won the bid for the state business, which is why the changeover. Are you aware of network size at all? Have you investigated or heard anything about whether or not the Regions network is a tighter, smaller network than the Cross network, and is that going to impact employee access to their providers?
The information that I have received from the Office of Group Insurance has indicated that there won't be any impact to the employees.
But I'm assuming, and correct me if I'm wrong, that these other companies had a chance to bid on that contract.
Yeah.
Just to get it.
I would assume so, that was open and that Blue Shield is the one that won the bid.
Any more questions for Gary? Go ahead.
Oh, I just wanted to say how much I appreciate having the other counties and the state information on here.
Well, and one of the things, like, if you look at Valley County, we gave pretty awesome raises over the years because we have a cost of living issue up there that people can't pay even a rent or a mortgage with that salary. And we're trying to get it up to where we'll retain staff longer, be more career oriented staffing. And we haven't really even talked much yet this year as far as budgets. We're just getting into them, but I'll bet it's going to be at least at 5% again this year. Because it's so expensive to live up there.
And you notice that Boise County, they really made some aggressive moves for this year.
Yeah, you gotta keep those salaries up. Our biggest competitors are St. Luke's. There.
Yeah.
So any more questions for Gary? If not, we'll move on.
Thank you for your
Thank
time.
you, Gary.
Thanks, Gary.
And the reality is, as you all know, the time when we're able to provide bigger, more generous salary increases aren't forever. I looked back through some historical budgets and there were 3 years in a row during the recession years, it was 0 increase. And then we started to creep them back up real slowly. So I think it's important to take advantage of a strong economy when you can, knowing the day will come when we're not able to do this. We'll have to make more difficult decisions somewhere down the road. Operating costs see about a 13.4% increase. A lot of that comes from just the cost of goods and services. If you mentioned fuel's going back up, you can see our whole fleet of cars out here that are typically on the road every single day. So just operating cost in general, salary cost goes up. That doesn't directly impact the operating budget, but everything we do is impacted by in one way or another by inflation. So, and that doesn't seem to be slowing quite at the rate I think the Fed would like it to. Capital outlay. Yeah,
Can I interrupt for 1 second?
Yeah.
A question popped into my mind. You mentioned that we're budgeting for 5 fewer employees. Can you clarify, is it just we're budgeting for 5 fewer, or are the underlying employees or positions fully staffed? Or are we just knocking off 5, but using 100, but budgeting for 105 instead of 110?
We have three primary funding streams that are changing this year. So one of them includes a staff loss of 3 to 4 people. We're still working out some of the details and haven't gotten the final amounts on what the numbers will be. And then we have a couple discretionary grants that are coming to an end in the October to December time period that have an FTE associated with them. If we're able to secure additional grant funding, we would continue with those FTEs and add that in at budget revision time. So we're planning that there will be a reduction of about 5 people. That could change based on what happens with the funding streams. Putting the budget together this time of year, we're not always sure exactly what numbers we're going to get, but at this point it is looking like a reduction of about 5 staff.
And we're not budgeting necessarily for extra staff that we're not using,
We are not. These are actual FTEs
that are,
currently here and 5 that,
Do those grants come and go off budget cycle?
yes, they do.
Laura, another kind of, since we're going down this trail, I'm concerned too, because I think in Valley County, we don't have a provider, so we can't do reproductive health at the McCall office anymore. And I've been asked by both St. Luke's and Cascade Medical to bring that back because it takes a lot of heat off of them. What is the plan for that?
The primary plan is to expand our telehealth services and get the demand back. We've tried multiple times in the 3.5 years that I've been here to have either an RN or PA there, or to have one of our NPs from this office go up there once a month. None of them have sustained steady clientele, although we continue to hear that the need is there. So we are balancing out, do we put somebody there again and continue to hope that people will come? We'll get the referrals, or do we wait till we have a patient base up there and then look at putting somebody there more permanently? But we're hoping to be able to provide some services through telehealth. And we do have some of our mobile teams are already providing services in Valley County for immunization clinics and that kind of thing. So they're regularly going to Valley County. Our dental team does that as well. So it's just a balance of determining exactly what the need is and how best to staff for that. But if you can help us with establishing a patient base, it could inform the decision.
But have we budgeted for that provider for that office?
Just for providing telehealth out of this office. We haven't budgeted for a provider in the Valley County office.
So how much would that change the budget if we budgeting for that full position?
And one additional FTE of
One FTE?
it would probably be off in
What's
the
that, about
150
100,000?
to 160 range for like a full-time NP with fully burdened.
You said 150 to 160.
Yeah. I can get much more specific with a little more time. That's just.
No, I appreciate that because I think it helps in Valley County way for us to sell the budget. Hope honorary commissioners up there that, hey, we're working on trying to get an FTE person up there. It's a real issue. Valley County, it's been, I don't know about your guys' schedule.
Well, and even if you could have a part-time,
Even a part-time would
yes,
be
it would
awesome.
really help, because
1 or 2 days a week.
and we have tried and we even had 2 part-time. We had a PA and a nurse practitioner, and it was just a matter of trying to figure out, because there's usually part-timers are working somewhere else, so they have their schedules dictated by the other employer, in this case, St. Luke's, and having our flexibility to see patients when we can get them in, and then just the patient demand. Then when you have a nurse there, they are limited with their scope of practice and what they can do as far as diagnosing and prescribing, as far as not doing that. So it's
Nurse practitioner would be
Yeah.
better.
right.
That was Meg Fitzmaurice was our last one. I
Yep.
think.
Yeah,
Okay.
and our new model that we're gonna work toward is having telehealth, although clearly not all services we provide can be done through telehealth, but if we can do some initial visits and screening and education, and then have a day where we would need somebody in person to provide reproductive health services, for example, then,
Maternal fetal's a lot harder without hands-on.
right?
Yes.
Yeah, so,
I think it's more, I don't know, I could be wrong here, but I think it's more STDs than reproductive health.
right,
It's becoming a bigger issue up there.
Everywhere.
The other question I had is, we've had 3 people in the last couple of months that have OD'd on fentanyl. I think there's quite a few down in Ada County now. Have we jumped our communication budget to get the word out to folks that one pill is all it takes to put you under? I mean, we need to do some more scary stuff, some scary marketing to folks that
yeah.
be careful what you're
New
doing.
billboards going up concerning that because especially in the younger population that think they're getting a off-market Adderall or whatever, and 80% release with something these
I
days.
think 2 of them were in marijuana.
Oh, wow.
So now it's like they're mixing in, and kids don't even know that. So we got some real communication issues with our younger folks. We got to start working on, I think.
We thought about traffic professional, like on a 90-day contract.
We have not,
Another 90, I mean, I know that you don't have the French, you know, you have to pay the higher salary, but it might be something where you have them, you know, and I just thought.
yeah,
So could you work with like, I know Cascade Medical Center, I think has 9 or 11 providers. I don't know what St. Luke's has, McCall, I have no idea, but working with those 2 entities, say, hey, we want to hire one of your folks part-time, 1 day a week. Have you done that?
we had, that's, Meg, for example, works primarily at St. Luke's, and she was working for us part-time for a period of time. And we hear about the demand, and then once we set up the services and promote the services, we haven't had full clinics, so then you end up with a pretty high cost per patient. Not that we're not willing to do that for the patients that need the care, but then the providers choose to work more hours at St. Luke's or work less hours overall, and it's just been a staffing in rural communities. It's pretty tough, but something we'll continue to work on. So we are going to go full in on telehealth. We have a new office services supervisor up there, Nick. He's really doing a great job in promoting our services, and I think that's something we'll have to work on. We do have full-time environmental health. We have part-time WIC there, as well as all the land applications and food inspections, childcare inspections, and things like that. But
Staffing issue is a national problem.
Right.
It has been for 30 years.
yeah,
Right.
we're part of that. We're
Well, I'm glad you guys are at least got it in the back of your mind that we'd have to start working on that. I just want to make sure we have the budget to do it if we.
Well, and it's growing so much in our rural communities. And there's nothing like hands-on for a maternal child. Telehealth just doesn't cut it.
No. Yeah, I think what the vision was with telehealth, what the vision is to be able to have our clinicians, if they, let's say today, if a patient in Valley County wanted to be seen, that we could try to fit them in with one of our clinicians today. That would have to be done through telehealth, and then schedule a follow-up appointment depending on the circumstances within a reasonable window of time. It's not going to be, we're not doing any type of real urgent or emergency care. They need to go to Cascade or go to St. Luke's, but ours is more primary care, preventive care, scheduled wellness type visits. So
How does that work? If somebody comes in at either McCall or Cascade and says, I think I have an STD, do they automatically shift them to us, or do they actually run the test?
they should be doing the test at those
And then
clinics.
they're all reportable to the state,
Right.
depending on the type of STD. Well, not all STDs, but there are a majority that are.
So it's not based on income or anything like that. some of these folks, I'm assuming would qualify for our program because of their low income.
We test anybody that comes through the door. It's not based on income. How much you pay is based on their income.
I guess the thing that keeps going through my mind is, why is this such an issue with Cascade and St. Luke's? Why does this bother them?
I don't know.
Because to me, it's just part of your job, But maybe it's an income or they're not getting enough off Medicare or what, I don't know.
Yeah, right, a lot of,
Or get paid for
But
it.
not get paid.
right.
Well, and the other thing that is important to know is that Cascade Medical Center just opened up a new clinic in Donnelly. In fact, I think today is the first day. Maybe it's next Monday. And there's a lot of issues in Donnelly with this very thing we've been talking about. A lot of low-income folks. And I'm kind of excited to see that because Donnelly's projected to be the largest city in Valley County here in another 15 years.
Wow.
Because of the growth there. Okay, well, let's go on with this report.
Capital outlay, you can see the facilities projects we have there, McCall, ADA compliance, concrete repair. I'm sorry, that's on page 5. Mountain Home, ADA compliance, so it's just bringing our facilities up to code, something that we've needed to do for a while, and we're going to budget for it, try to get it done this year. Boise office, we've kind of held on a bathroom remodel based on the first quotes we got. Well, the first one quote, very high, so we decided we would pause on that until we can get at least a couple quotes, something to have a comparison to, make sure we get a fair deal. And then same thing with ADA compliance here, and then our some HVAC equipment that needs to be replaced. For vehicles,
Quick question on ADA compliance. How old are these buildings that they're not currently in ADA compliance?
they're all 30 years of age and older. And we have made some upgrades, like we put a ramp in back here, and we did it at a time when the cement was crumbling, so it needed to be fixed anyways. Rather than fix a curb, we put in a ramp as an example, but we have very few ADA access points to this facility. So, for example, if you needed to come into our medical clinic, you have to go way down the sidewalk to get access to a ramp. And then a lot of our rear doors, in fact, none of them have a button that you can punch that have the door open automatically. So those are the types of things.
So code changes or updating to the new codes.
Exactly. And, there's some rules around that until you do major remodels and what have you. But at the same time, I think it's the right thing to do if you're in a wheelchair, for example, and trying to get into a public facility, even though we might not be required to because we're not doing a remodel of that particular area. I think it's important we've talked about it a lot, just to.
Primary thing we want to do is those doors that open with a button touch. We don't have them in any facility except the one front door here. No employee entrances that have the ability to push a button and open. So anybody with mobility impairments, it's able to get in our building. So, but Mountain Home and McCall, we do have mobility impaired clients, customers, and patients pretty frequently, and especially through harsh weather, having to get up to a small door without the ability to push the button to open it has been quite a problem. So we'd like to be able to focus on that.
Question on the Ford F-150, are you guys part of the state bid process?
Yes.
We are.
Because we're getting, this is a half-ton Ford. We're getting half-ton Dodges right now for $28,000, $29,000, one right after another from the county. And I don't know why that's.
This was an estimate based on what we'd seen last year. We'll go with whatever the current pricing is. If we can get it for 28, we absolutely will. Yeah.
I know we bought 8 Durangos for our sheriff's deputies, and these are pursuit rated vehicles. We got those for 27.5 or something. Wow. Yeah, so that's a little high.
And this is, I think we just looked historically, and car vehicles have been
Yeah.
kind of at historical highs, and I'm seeing them coming down,
Yeah.
right, in the general consumer market as well. So we budgeted for 40 and hopefully we'll be able to get it for less.
Yeah, you should be able to.
Operating budgets, pretty much trustee and benefit cost. The budget is about the same as it was last year, 24 to 25. Go to page 6, state appropriation designated. So this is not to be confused with the pre-House Bill 316 state appropriation. That was over a $10 million appropriation. It got divided among the 7 public health districts through a formula. What this money is we still get an appropriation from the state that doesn't come directly to us. It goes through the Department of Health and Welfare, so it becomes part of their budget, and then that money gets allocated out to the 7 public health districts. The 2 large sums of money, one is for home visitation. That's a $1 million appropriation that goes to the health districts in total, and we get our share. And then the second part of that is a $2.1 million statewide Millennium Fund appropriation, which has gone up considerably. We had historically operated primarily, it was tobacco cessation, and it shifted to tobacco and vape cessation. Now it's pretty much vape cessation and prevention. And the Millennium Fund Committee has been, I think, very generous to the public health districts, realizing the challenges we face. So we will get a much larger share of that. And the trustees will be voting on the distribution formula sometime. The meeting's not set yet, but sometime in the next month. And this is based on what the formula that the directors have all agreed to. So that'll be good. We get a much larger share of that. The appropriation went up, and we'll get a larger share of that appropriation.
Question on that Millennium Funds, Russ. In the past, we have had an issue with the Millennium Funds getting used, channeled off for other issues other than tobacco cessation. And that, do you feel like that's really, we're on top of that now?
The state, I mean, I think they did have money for like rehabilitation facilities and centers, and I presented to the Millennium Fund Committee, and I think they're tightening down on that just to make sure it's being used and used for the intended purpose. So the schools got a lot more money. Probably saw in the news they're putting in vape detectors, and I think Mountain Home School District may be one of the ones that received funding to do that. Yes, they're going to put them in the. I think the headline was "Smoking in a Boys' Room." Anyway, no more vaping, I guess it'll be.
So Russ, on the expenditure of those funds, is that picked up in our audit? Does the auditor come back and say yes or no on those?
I mean, the money is designated, so we have to report back to the Millennium Fund Committee what our performance is, how many people we served, how many policies, we have worked with school districts and city parks and things like that to create vape-free, smoke-free zones. And so, yeah, I mean, it's accounted for as far as we can't use it for providing immunizations. We have to use it for the intended purpose.
Okay, and then I guess the other question I have, and I've been looking for it, is where's the ARPA or the opioid dollar? I know that's a pretty big chunk.
So the opioid funds there's going to be personnel costs will reflect some of the opioid funds, and then T&B, which is money we're sending out to our community partners. We've been providing mini grants. Those are going to get stepped up because we continue to receive additional funding. So likely you're going to see an increase. Well, I know you're going to see an increase in the T&B costs when we do the budget revision in February because we've received additional funding. We're in talks right now planned with Idaho perinatologist at St. Luke's to figure out how we can better serve pregnant women with opioid use disorder. And prevent neonatal abstinence. So I'm really excited about that. They have some ideas as far as their staff doing home visits, early in the pregnancy and throughout the pregnancy, because they, as I've talked to some of the physicians, that's one of the challenges they have is getting pregnant women and have substance use issues to actually come in and even show up for appointments. So that'll probably take a big chunk of the opioid settlement funds that we're getting.
Russ, this is a little bit of a sidebar. Whenever you have massive amounts of money coming in, like the opioid issue, is there oversight on those, the use of those, specifically to prevent abuse of those, misuse of those funds?
We actually have to report to the Attorney General's office. That's who's providing the distribution. So there's Exhibit A, which Courtney, I think at the last meeting, talked a little bit about what we can use those funds for. So it's very restrict reporting. And Curtis, if you want to talk about that a little bit, a lot of that money's under your team, how that works and what the reporting requirements are.
Yeah, thanks, Rustin.
Go ahead.
Sure. Yes, we are restricted by what's referred to as Exhibit A, which in the settlement agreement limits the ability to what the money can be spent on. We are accountable to report our expenditures and all of our activities back to the Attorney General's office for them to review and reconcile and make sure that those funds are all spent in accordance with the master settlement agreements.
Couple of questions on Curtis. Has anybody ever been caught not spending it right, and what happens?
I'm not aware of anyone that's
Not
been
either.
caught
That's why I
not spending it right, but my understanding is if funds are found to be spent on non-allowable expenses, then those funds would need to be either recuperated and then refunded back to funders. And then we would be held accountable. And all of that is within the purview of our yearly audits that occur. And so we got tabs on that and make sure that that's reviewed annually in our annual audits.
And the second question is, have you heard if there's more money coming?
We do believe that there will be more money coming. We are not exactly sure how much money of that will come. We do anticipate receiving an unknown amount of money over an 18-year period of time.
Because that we do in our county, we kept the money and we put it out ourselves. I think Ada County gave you guys their, no,
They did not.
so we got, that money that we got wasn't from Ada County, that was from the total sum.
Yeah, so each of the health districts are awarded a percentage of the agreement settlement. And so we will receive that on a continual basis. We don't know, like I said, how much money we'll receive on an annual basis, but I believe so far today, we've received $2.6 million in settlement funds, which represents for some of for parts of the agreement, it could represent multiple years worth of payments. And so we're working with the Attorney General's office now to try to understand what the total amount will be that we will receive and how much of that we've already received and what we can reasonably anticipate to receive over the coming years.
And I'm assuming, correct me if I'm wrong, we can't use that money for fentanyl use. It's only for opioids.
Yeah, we can use it for.
We can't,
Is
That's an opioid.
So it should
so we should be able to
Correct.
use some of those funds for fentanyl.
Yeah, it should be useful.
Good.
Yeah, one of the challenges we have that Curtis just described is we would have, this money was to come in over an 18-year period of time. What we'd like to do is figure out how to spend it over the 18 years so that we don't spend it in the first 8 years and then have nothing. But when you don't know what the total amount's going to be, and it was to come in over that 18-year period of time, and then a lot of the pharmacies and distribution companies paid up front. So I've been in discussions with the AG's office. Let's figure out what are we actually going to get. And I know we may get more. That's what we keep hearing. But what do you anticipate from these companies are we going to get? And then there's potential they'll go bankrupt, and we may not get any more from them anyway. It's not been exactly clear for us for budget planning purposes. So we haven't gone all in yet. And that's something we definitely need to do now that we have $2.6 million in our.
And that's what happened with Rite Aid.
Right.
Freddie went bankrupt instead of paying the fine.
Do you feel like the,
It's gone.
we're supposed to use these funds for treatment, but we also know that demand will also always create its own supply. So how much is being allocated for that? The demand issue?
Go ahead.
Yeah, so our approach right now has been to, as Courtney presented on at the last meeting, in regards to the use of the opioid funds, we've implemented medication assisted treatment here locally in our clinics. We have, as Russ pointed out, we've been doing grants with many different types of community partners to provide education and training, outreach and prevention efforts through all of our different communities, through different venues. And then we're also working on treatment options right now and trying to provide additional remedies for overdose, such as Narcan and other things like that throughout the communities. And so we're looking at both treatment and prevention and education and all of those different areas, and working with the community partners that are willing to work with us and helping to fund them using evidence-based practices and curriculums that will help to educate and hopefully reduce the demand.
Sure. It's interesting just from a philosophical point of view that, we have the funds coming in now. We think we may get funds over the years. The end goal should be not to need those funds if we're doing what we're doing right. And if you look at the Netherlands model and the Portugal models, they've gone from thousands of overdoses to in the tens of overdoses over the last several years. So what they've done in certain countries have been highly successful. If we can model on what other countries have done, succeeded to decrease demand, to educate and use those funds properly. That way we're not dependent upon, money coming in years. If we do our public health job correctly, we should be able to hopefully follow the same models that of the success of others. It's just a philosophical observation.
Yeah, that's a great point. That's something that we're ready to hit the gas pedal on. And you heard from Courtney at the last meeting, some of her ideas, very talented team. So we have the right people in place now. It's just a matter of getting a little more clarity from the AG's office. And then I think we'll likely, when we come back to the budget revision proposal for your approval in February, you'll see that reflected there.
Russ, how often are you in contact with the AG's office? Because it seems like for a couple of years now, we've been waiting for the AG's office to let us kind of do this or know, or who was in and how much. Nothing ever seems to come forward. Is there anything we could do as a board as far as a letter or pressure or something to smooth this along a little faster? I don't know. I'm just
give that some thought. I have been getting feedback from one of the deputy AGs on this particular issue. We just haven't got clarity on the question that I have as far as, here's how much money we have, how much more do we anticipate based on the lawsuits that have been settled where there is an agreement, and then what's in the queue. What's in the queue, right? That's up in the air, but I just need more clarity on what I can't say with certainty, but what we're most likely to get. So we used to be in regular contact with the AG's office, but so much anymore.
well, we have kind of an ally in there now that should be able to say, yeah, we need to figure this out. If it would take a letter from us or what, we could certainly, discuss it and vote on it. That's how everybody else feels. But sometimes just a letter is enough to push people over the edge to get something done.
Right.
Think about.
Thank you for that offer.
Okay, let's go on down. We're at the bottom of contract.
Contract revenue, you see a pretty sizable decrease. A lot of that, most of it is coming from the ARPA money that we're getting from Ada County. So they gave us several $1 million, and that money is scheduled to end on December 31st of this year. Although talking with their team over there, we would have the ability to continue to spend that beyond December 31st. So we have a certain amount of money that we have to spend. We're not getting more money after that, but it's a matter of being able to continue to spend it possibly into the next fiscal year as well. Page 7, fee revenues been pretty flat, and that's what we project for the coming year. I don't anticipate there will be any reasons for that to change. Other revenue, I see a sizable increase. Some of that money came over from contracts. It's just restated in the other revenue category because it's the opioid settlement funds. It's not coming to us as a contract. So it's just restated in the correct area. And then interest revenue, which we've talked about, is going up considerably, or has gone up considerably. We used to get basically nothing, like in your own personal accounts if you had it invested in savings accounts, but that's all changed. So that's really good to be able to generate over $500,000 in interest revenue from the cash that we keep in our long-term government account and be able to take advantage of that, because the money's got to sit somewhere until you're spending it, right? You have your cash flow coming in, money coming in, or cash flow for money being spent. And then we keep our money invested so we can generate revenue off of that. So I think it's a good deal, at least for now. Reserve and restricted funding. This money, there's funding there for money that we received, like for home visiting, that we're not necessarily planning to spend this fiscal year. We're not using county money to cover that cost. What ended up happening is we get the state appropriation and we get state ARPA funds for that. We received Ada County ARPA funds for home visiting, and we get contracted funds. So it's not going to necessarily be spent, but it's restricted for that purpose. So it's not, again, going to be used for other activities. If it's designated for home visiting, that's what we're going to use it for. And that, I mean, the good thing about it is we have that discretion to be able to carry that forward into future fiscal years. The downside is if you staff up enough to spend the money and the faucet gets turned off, then you run into a more challenging situation with staffing. So last couple of pages are all the codes and programs, and that's exactly where the money gets spent. You can see fees, contracts, other revenue, and all the expenditures, as well as the district funding in the far right column. And I'd be happy to talk about any of those specific programs if you would like, and maybe for the sake of time, though, we could do that offline.
Does anybody want to talk about any of these specific fees or permit fees? You can really get down in the weeds on this stuff. And a lot of them, I don't know what they are.
Laurel and I talked about before this meeting, maybe next year, is doing this in a format that's a little bit more readable and more descriptive so that you know what they are. There's a lot of acronyms used there,
right,
abbreviations, and I think just for transparency's sake for next year, we'll plan to, possibly do a fold out or a landscape, so it's easier for everyone to see with footnotes.
Yeah. I do have just some random questions, looking at the allocation based on like infectious diseases and whatnot, the communicable disease control. I'm considering what we discussed about STD and whatnot. I mean, I'm noticing we have like 700,000 allocated for COVID at this point is essentially a quote for most. But then we're talking about the STD problem and the allocation of funds in one area where it's actually a medical community concern versus what we've gone down to in terms of lack of concern in other areas. So I'm just wondering, a shifting of some of those funds might actually pay for a nurse practitioner in our rural counties. So, and I know some of those are the COVID ARPA funds that came in,
Right.
but just from a practical point of view and what the disease reality is versus what we should be focusing on, I think some of those funds, how we have them allocated, could actually be better utilized for the pertinent need of the moment. That's just,
And I
What
think
I-
that's a legitimate ask of this board is how, but what I do like a lot about this is if we don't spend it all on that particular program, we can flush it over to the next one. It gives these guys a lot more opportunity to kind of move stuff around.
I mean, I know there's 100 lines here, but that was just my first quick observation is we could quickly reallocate and really have an immediate help, especially up in rural.
If I can make a comment on that, so in the revenue column for I think you're looking at our project codes 38040 and 38045. So what we're receiving in that is $160,000.
Gotcha.
So we have existing staff in that program. That is where one of the reductions is going to occur.
Okay.
So right now we have still budgeted for part of their personnel, not to carry it all the way through the fiscal year, and with the potential that some of them may be charging to other funding streams. But that funding stream coming in as revenue has been reduced by about 50%, drastically reduced from what it was last year.
The add to that, get your point completely, is when you get contract revenue or sub-grant revenue, as you know, it's prescriptive what you can and can't do, but we are receiving money for basically COVID vaccine equity, and there's the restrictions aren't that on that particular sub-grant aren't quite as tight. So we are able to use that money to do back to school immunization clinics or flu vaccine clinics. You just have to have information about COVID vaccines. You don't have to be administering vaccines, and the vaccine demand for COVID has dropped off dramatically. So even if it's COVID for COVID vaccines, we are, with approval of the state who's administering a sub-grant, able to do a lot of other work out in our communities. It's not COVID specific, but they're still.
Yeah, and my commentary there would be, we have a, supposedly updated Pfizer vaccine, which is not updated to something that's extinct. So it's throwing good money after something that doesn't exist. And then even with the flu vaccine program, if you look at CDC data, the percent efficacy there is in the teens at best. So we're chasing things that are evolving that aren't there. And again, I know budget allocation, contract allocation becomes a problem. And it's responding in real time to community health needs versus things that are basically impractical at this point. And that's just based on basic science. And so I appreciate the ebb and flow of funding and designation in certain areas. But if we're going to be nimble, then I think, reallocating to the actual pertinent need of the moment, health-wise in the communities.
Right.
I mean, as a board, I hope that's something we could influence.
Yeah.
And I think that's what I enjoyed most about this board is we're able to react a lot faster.
Yeah.
Locally than even statewide or national. We're obviously way ahead of the game.
Yeah.
Okay, anything else you guys want to ask on that one?
Yeah, Mr. Chair. Question for Laurel. Laurel, do we get interest income off of our reserve funds? Okay.
Is that through LGIP? Yeah. Which is like 5.5 right now. And we just moved all of ours over to LGIP.
Yeah, I want to invest in cheese ball futures. That's where the returns. I have a couple of line item questions just to kind of get an example. So like the IDT, seatbelt survey, as an example, what kind of survey, what does that constitute?
What page are you
I'm on that first page 8, about halfway through that bottom block. It's, $1,200, seatbelt survey.
So we do that on behalf of the Idaho Transportation Department, and basically you have volunteers or paid individuals to stand at stop signs and mark people wearing seatbelts or they're not. So it's just monitor compliance use rates for their benefit. So they give us, it's a cost that they pay for, and it's data from just a public safety perspective.
Okay, and then maybe as an example, I'll go up to the top of that block, 6,600 in citizens review panel. What does that constitute?
So that's money, these are great questions, and that's why with the bigger spread sheet next year, so you can actually read it easier. Is Citizen Review Panel it was established by the state of Idaho and the legislature, by the legislature, and that is a group that we provide administrative support for only, so we receive state general fund. And the Citizen Review Panel is a group of volunteers from our community who review child protection cases, foster care cases that are open over a certain period of time. And then they, in our district, and there's 6 other citizen review panels in the other health districts, make recommendations to health and welfare. And there's a legislative oversight committee for essentially for foster care. So it's trying to make improvements to the foster care system, but our role, there's a lot more to it, some negotiating so we can get more home visiting funds, which can impact foster care, certainly, if you have, successful families. And in place of that, or in exchange for us getting that money, the legislature asked us if we would provide a facility and provide administrative support.
So that's what I wasn't certain. I was unaware that CDH had a tie-in to, I didn't know if this was some sort of separate CDH functioning citizens review panel, but when we get to the new spreadsheet, will that give a little bit more of the description and how, I brought those 2 things up just as examples of where more definition or more detail would add a lot more clarity into, I think partially what Dr. Cole was leading to is, where funds are being used at the moment and to what extent, and then that have that greater detail. Maybe we need to consider, well, this is a past need, we need to shift to a current need.
Right.
And I think a lot of that is really dependent on where you get your revenue. A lot of it's restricted by somebody else, but I think I can see is a couple more pages with this. It's like a subsection for each one to kind of explain it. And I think it makes perfectly good sense to do that.
Another option is I'm happy to do that during the year too. If there's any of these that you'd like to request more information on, either I can provide a more detailed breakdown of the funding, or we can have the program staff who work in those programs come and present. So if you have any of those that you'd like more information on, you can throughout the year as well.
Yeah, Mr. Vice President, comments this week, I just find it ironic that the cardiovascular health program, the acronym is NACHO.
Nachos are good for you.
They're a food group, aren't they?
Okay, any more questions?
I did have a question on, back to page 4, just how you got to the operating increase of 13.4. Yeah, how did that number come up? CPI.
Yeah, so how we put the budget together is we look at what the costs have been, the actual costs have been for this year, and any known anticipated costs for next year that would precipitate a change in that. So we worked with every single program manager to let us know, or look at what we spent so far this year. Do they plan for that to be a straight line increase? Do they plan for it to stay level? Do they plan for a decrease? And do they have any known expenses coming up in operating? So we work at program level, and then the DAs and Russ look at each one of those funding streams and make sure that the things that are planned for make sense, and then go through an approval process there. So most of that cost, as Russ said, is due to inflation and some of the other programs, goods and services we plan to provide for the next year. And we could do, that's another area where we could do more of a breakdown if you'd like to see how it breaks out. It does come out in the line items of the really, really small print. So as we're focusing on any of those programs, if you would like to know what the specific operating costs are for those, we'd be happy to provide them anytime.
Just wondering how you got to that.
Yeah, that's how it comes up. And then all of these sublines in the operating expenditures for each program add up to that total.
I think we're looking at that or a little bit higher, just some fuel costs this year for the county, for the road department and never all the vehicles. It's like just the fuel costs went up. Crazy. Okay, no more questions? Everybody's good with this budget? This is an action item, isn't it? Yep.
It is.
And so we need a motion and a second to approve this budget.
As you,
A second?
I'll second it.
Got a motion and a second to approve the FY 2025 budget. All in favor, please say aye.
Aye.
Any opposed? Motion passes with full support.
One other thing,
Oh, now you bring it up. Al.
it's not directly related.
Oh,
to
don't
the-
forget, I forgot.
Okay. So the meeting schedule, so you should have heard from Donna, that's the pre-budget meeting hearing schedule. So for Boise County, that'll be Tuesday, April 23rd at 10 a.m. Ada County, Wednesday, May 1st at 11 a.m. Elmore County, Friday, May 3rd at 11 a.m. And then Valley County will be the last one on Monday, May 6th at 11 a.m. So obviously, if you're a commissioner, you'll likely be there. But if you're not a commissioner, I would appreciate it if you can make it. I know you all have busy schedules, but it's nice to have you there for your support.
And it's a really pretty quick meeting. Most of the time.
can you give those dates real quick again, Rick?
Sure. So Boise County is Tuesday, April 23rd at 10 a.m. Ada County is Wednesday, May 1st at 11 a.m. Elmore County, Friday, May 3rd at 11 a.m. And Valley County, Monday, May 6th at 11 a.m. And those are all in the commissioner quarters is where we meet for each of the counties. And did you send them a calendar invite?
I sent an invite to your particular county. So if what the three of Ada County should have got your meeting, and then you should have got Elmore, vice versa. Should have got yours.
Correct. But you can attend other ones if you wanted. It's just,
If you would like me to send all of them, I can. I just did your particular representation. Your county.
Well, I think it's really kind of important for all of us to be at these at the county level to kind of explain this budget, why we're asking for a little bit more. Which is okay. It's not world ending. But those other commissioners have no idea what we do, honestly. They're just looking at dollars, so. Important to be there and support us.
Honestly, Ada County has been our biggest challenge, and Jane has put a lot of effort into trying to educate them as to why we're asking. So it is appreciated.
Their numbers went down this time. So.
Yes.
Real.
Well, and keep in mind too, this election year, you may have new commissioners starting next year, so
yeah.
everything changes. Okay, the next agenda item is a discussion on social security. You want to take a break?
I am.
Let's take a 5-minute break and then come back. 5 or 10, whatever you.
Are we ready?
I know what I need.
So, three farm.
Dustin, are we ready? Okay,
That's fine.
okay, we're gonna move on to our next agenda item. This is not an action item. This is a discussion on employees portion of Social Security. Rachel and Jackie, if you guys could come on up to the, I don't know where you want to come up, I guess to the podium.
Laurel's good.
Laurel's.
And someone that's kind of gonna introduce this.
They're available for questions.
Oh, okay, okay.
Okay.
There we go.
Yeah, so first, thank you, Jackie and Rachel, for being here and waiting till we got to this part of the presentation. And if you have any questions about the yes, no vote, what it means for employees, anything like that, they can answer those. And I'm going to try to succinctly go over the Social Security employer options if we were to have a no vote. So it's a little bit of a reminder at the next meeting, the May meeting, it'll be an action item to vote on what you would like to do with the employer contribution to Social Security if the employer vote no in September, effective October 1. So, and you all are participating in that vote as well as the contributing employees. Go to the next slide, Dustin. So the slides are on the screen. This is the handout that goes along with the slides that are on the screen, kind of the summary view of them. So just a reminder of what we're going over, understanding what options are available if staff does vote no. We'll look at three main buckets that employer portion could go into. That would be contributing directly or giving it directly back to the employees, contributing to employees' retirement accounts, and then using it for agency operating budget. So option one would be to give that money directly back to employees. There are a couple of ways we could do that. One would be just in a bonus. Easy, we'd say this is the amount of money we have available. This is how we want that bonus to be distributed among the employees, and this is the frequency that we'd like to do it in. More than likely be annually or semi-annually. That would be at the board's discretion. Benefits, drawbacks to that. Benefit is that it's a lump sum received directly to the employee, so it's high visibility, high impact to them. Of course, it is taxed as a bonus, so that's the main drawback to that option. Another option would be to do a salary increase for employees. It's about 6.2%, so we could give it to employees that way. Wouldn't necessarily need to be an ongoing salary increase. If you were to decide to do something different with that amount of money in the future, you'd have the discretion to change that. That would be the biggest impact to the employee's take-home pay, and it would be taxed like a normal salary increase would. So they would notice it in their take-home the most. But again, you could change your mind on what you wanted to do with it at a future point, and it would be taxed like a salary increase. Going on to bucket two, we have the option of contributing to employees' retirement accounts. There are lots of different ways that we could break this down, and we talked about that, some of them at a very high level at the last meeting. So over the last month, we talked to Percy Choice 401k, and we talked to Nationwide about what options they have available for retirement accounts. So I've tried to summarize it as much as possible in the handout with some benefits and drawbacks, what the frequency would be that we could disperse those and what it would look like for employees. So that first bucket of contribution to employees' retirement would be the Percy Choice 401k. If we were to do that and just put it directly there, it could be annually, semi-annually, or quarterly. The main benefit of this is that the account is already set up for employees. Every employee has a 401k set up. There's no impact on the pre-tax contribution maximum. The one thing to consider here is that the employee must be actively employed at the time that it's paid. So if you're doing it semi-annually and somebody left over that time period where they would be accumulating what would be deposited into their 401 choice pay, they wouldn't receive that if they were no longer working for us. So could be either an incentive for people to stay or just something to consider there.
So Laura, could we pay up to the time of dismissal or termination? Like if they had 2 or 3 months into the second half?
If we have it set up whatever frequency we have set up to pay it, it will be our only options to pay it. So
Okay.
from what we understand, it wouldn't be an option to do, to prorate it. And to through a certain
I'm
period of
assuming
time.
in my little brain here, that's probably best to quarter.
That would, be the less loss to employees if they
Right.
were to leave. Yeah, least loss. Another 401k option is the Percy Choice match. That we could do every paycheck. So we could dedicate a certain amount every paycheck to employees. That option does require employees to contribute something. So for any employees who are not contributing now, it would be a change to their paychecks. However, we can set that ratio up however we choose to. So when we say match, it just means that the employee has to contribute something. So we could set it up like 1% by the employee and then the 6% by the employer. So as long as they're contributing something, we get to decide what that ratio is, and it's still considered a match.
But our max is 6% of that, so.
Yes, 6%. Just, we're limited by that because that's the amount that the employer contribution is. If we were to choose to do that anyways, or, aside from the Social Security option, we could dedicate normal budget funds to employer match if we wanted to. Right now, I don't think there's other entities like us who are doing that, but if we went over the 6%, it would be coming out of district funds or another funding source. And then, so we would require by policy that employees contribute something, and that is something we don't have in place now, so that would be a big change to employees. Moving on to the 457 match, that could be every paycheck or a frequency that we decide. That is through Nationwide. So that would require employees to set up a Nationwide account. They don't already have that or automatically have that, so you need to require that by policy. That also, what CDH would contribute to that counts towards the max contribution. There probably aren't many employees that would impact, but for anybody who's already maxing out their contributions to their 457, they would have to reduce it by the amount that we're contributing. So may impact a few employees that way. The other things that they explained to us are this counts as a salary increase for payroll purposes, and that part of it would still be taxed. So 1.45% of the 457 contribution would be taxed. So it wouldn't be a tax or pre-tax, fully pre-tax option. If you have specific questions about some of the whys behind this, we may have to get one of them back here to provide all the level of detail. That's what I wrote down in my notes. So another option through Nationwide is a 401A match. That is also something we could do every paycheck or frequency decided by the employer. 401As, we weren't really familiar with that before we heard about it from Nationwide. They're only for public entities. They're very easy to establish. It keeps visibility to the contribution being separate from an employee's 401k or 457B. So they mentioned that some of the fire districts choose that because it's a very clear option that this is what the employer's designating to your retirement funds. It does not count towards the IRS employee.
I'm sorry.
Sorry.
Yeah,
Yeah.
a quick question while
Yeah.
you're there. Are there maintenance fees associated, planned maintenance fees associated with setting?
No, not that I am aware of. That's all. These are all options that, at least for the 457B, 401k, they're standardly available now, and employees can be contributing.
But the employer doesn't have to have
No.
a fee to maintain the
No.
plan or something.
And the 401A works just like the 401k in that regard and others. Another consideration there is that the employees must contribute for the 401A, but again, we could select what that ratio was for their contribution. That would be another thing we'd require by policy. So of these, the ones that would require policy changes and require employees to either set up accounts through Nationwide or contribute a set amount. Not sure how they might appreciate it in the long run, but maybe not in the short term. So there's considerations there. Another option that was presented was that the board could just designate the funds to employees' retirements, and employees could select between the 401k and the 457B. So you could say this is designated in this percentage, this distribution, and the employee could choose which type of fund they wanted to contribute to themselves.
Oral, do you know, can they transfer these Percy benefits to another, as long as it's another agency that does the same program, they wouldn't lose that if
Correct.
they can transfer it?
Yes.
Because I know that was a really big issue at one time. Okay.
Or are there any employees that are already maxing their 401 and 457 federally? Do you know?
I do not know. I believe there are a couple, but it would be a small percentage. I don't know if it's both. Russ, do you have any insight into that?
Then that wouldn't be an option. I mean, it would be, but then they'd be lowering it.
Right.
Okay.
Yeah, that, well, I don't know that employees would, even if we ask them, want to provide that information. And then moving on to bucket 3, and if you can advance one slide, so then very simple option compared to the last options we just went over, would just be to keep that level of funding in the agency operating budget, and it would just be an increase in the budget. Could be used for special projects or any other budgetary increases that we need, that the board has some discretion over. And that's kind of the summary of what the options are. So what we would like to ask today is that if you can give us some direction through discussion on which appeal to you the most, maybe narrow it down a little bit, at least what bucket is sounding like a good choice, then we can come back at the May meeting with a reduced set of options to vote among those choices. Not that these would be off the table, but at least we won't have the option that each board member might vote on a different different choice, which we've got now.
So Laurel, from our previous conversation, so if we send out the survey to everybody to give them the options, we would narrow it down to employee keeps it, Social Security, or investment fund. Give them 3 options, or a 4th option would be it stays in the operating budget, and just have them vote on those 4 options.
Are you saying that you'd like to gather employee feedback before the next
Yeah,
meeting?
that's what I think we brought that up in the last conversation, that, you know, everybody would kind of have a vote, and that way we would have a consensus of what the majority of the employees would want in terms of boiling it down to those basic options.
And I think that makes sense because they may say, no, I want to keep it with Social Security.
But
And then-
that vote is separate. So that's, yeah, I want to make sure, so at the last meeting, my understanding was that we were, of course, we're doing the Social Security vote, but you as the board have discretion. If that vote ends up being no, this is what we would like to do with these funds. We can certainly, there's nothing that prohibits us from gathering that employee feedback. We can absolutely do that within the next month. But it's ultimately up to your discretion, and that's something you could decide annually, based on our budget, or it could be set for a time period. So the employees need to vote on Social Security. Jackie and Rachel will be at our information sessions. You guys have all been invited to those as well, and will be voting members. The benefit of having you decide at the May meeting what happens in the case of a no vote is that it helps inform the voting process. So happy to gather information if you'd like, answer any questions about this. Social Security questions Jackie and Rachel are here for. And then we can go from there.
So assuming that that's the vote, my inclination is to probably not reinvent the wheel and go with that other, what was that organization? Nationwide. You know, I think I brought it up last time. Percy's pretty solid in Idaho. And if they've already got an account set up with Percy and so forth, logistically, it seems like that would be a smooth path
So nationwide is separate from Percy.
Correct.
Yeah,
That's what I'm saying is that we would have to, you mentioned that they would have to set up a new account and
through nationwide, yeah.
through Nationwide and all of that. My inclination would be to just expand the Percy option, make it easier if they've already got accounts. We're just gonna put some portion or whatever into that and not necessarily consider the Nationwide
So
option.
you're basically looking at, under option 2, the very top box.
Yes, the Percy option.
And that's kind of how I feel too. It's already set up, it's already in process, it'd be easy to.
I actually have been in Percy for several decades. And I actually disagree with that
Okay,
because people that are already maxing it out. And I mean, my personal circumstance, I try to max both of those out if I can.
Percy,
So-
this has no impact on the maximum of Percy contribution. It's only the nationwide that this would
The
be deducted
401k
from.
is federally limited as well.
Yes.
Yeah, the 401k is federally limited.
isn't that the 6%?
Not the employer. What we understood from the conversation is you as an employee would have your federal
Same maximum.
max limit, and then
Okay.
you got the catch-up provisions. The employer contribution would be in addition to that, is what they explained to us.
That's not going to affect their
They're
max limited. Okay,
No.
yeah, then that,
And that's kind of an advantage of.
So it's almost a bonus.
it's almost extra on top of that. Yeah.
Yes.
I know in my case, I go by what was performing as far as 401 or the 457 gets more money. You know what I mean? But if that's employer match and not employee match or employee, then yeah, I mean, then maybe that might be the best.
You know, have any idea as far as budget, if we go that direction?
Total
Budget's
cost,
gonna be about the same one.
yes, yep. Yeah, so about 800,000 is the number that we would be looking at for next fiscal year, at least from what we know now. And really in the weeds details, but I think it's whole percentages. So 6.2% is the amount that's saved. 6% would be the max that we could designate to be contributed to employees' retirement funds. So 0.2% would still stay in the operating budget, and potentially more with that, attrition and how employees may leave over the year, that kind of thing. So
Well, and I think it's really, to me, what I want to do is max out whatever we can for the employee, because that builds morale, that builds confidence, long-term careers, all that stuff. So whatever that takes, I'm thinking, do the best we can for them.
There would have to be a certain messaging that goes along with that and, not kind of get, I guess, kind of complacent, for lack of a better word, out of sight, out of mind, the money is just going over here and growing in this Percy plan. And is there a path to do a 4% and then a little money, in the pocket? Can we?
pocket of, whose pocket?
The employees,
So salary, like partial
yeah,
salary
like a
increase.
partial boost or something that's a little bit recognizable at the moment with a chunk of it going into the Percy and then the 22%.
Hybrid plan.
Yeah, but not reinventing the wheel with nationwide accounts and.
Yes, that would be an option as well.
Well, and I think the other thing you got to keep in mind is that this is a big payroll function, and if we can make it stable and continuous month after month where there's not a lot of changes, that certainly helps out that department as well.
One thing I wanted to mention as we're talking through this, what I'm not aware of is a mechanism for the board to make this commitment long term. Representative Blanksma brought that up at one of our meetings as far as committing future boards to policy decisions of the current board, so
So we'd have to have a sundown provision as to how long.
you never did.
Well, I don't know, Russ. I think that's really, we're not sitting long-term. This is gonna have to, I'm assuming be
Annual.
renewed annually. I don't know, but in the county, we can't commit more than 5 years.
My point in that is whatever you decide on May 10th is as good as what you decide on May 10th. And the social security vote will happen in mid-September. And then you can meet in October and say, we're gonna go ahead and move that to CDH's operating budget.
I think
So I
that's a
just
great
wanted to
plan, and I think that's perfect.
make sure our employees understand that that's what the current board's decision is, that's what their preference is, but it's only as good as the day that you make that decision, because in a subsequent meeting, you could choose to do something else with that, you or other, you said there's elections coming up, we may have some board changes potentially, so what I don't want to do is, unless there is a mechanism to commit it, forever, I don't know any, is that employees have to use some caution in thinking I'm going to get a 6.2% or 6% match. Great deal. So I'll vote on this. The big thing here we're talking about is the Social Security vote. This is just deciding what the board would want to do with the money. So I think part of that education is it's an awareness that this is what the board has chosen to do, but just be aware of that subject to change at any meeting, at any future date. So it might look attractive today to get a 6% match or 4%, 2% in your salary. But this.
That's explained to employees.
Pardon me?
Will that be explained to employees?
Yeah, I think that's something we'll talk about during the education is I think when we talked to Jackie and Rachel is that we thought it was a good idea. This is something a lot of employers do so that they know what their commissions or boards are thinking, but they still have to have that level of awareness that it's only as good as the day of the decision.
So it's not an annual, not for 1 year, because if the board says now we're budget short for whatever reason, then in a mid-year board meeting, we could say this isn't working.
At any time,
At
I
any
think
point,
they could, the board, whoever that board is, could change it.
So really, the only guarantee for the employee is to vote to stay in Social Security. And then that'll be the one thing that's guaranteed forever, right?
That is a guaranteed by federal law at that point, that you guys have to keep contributing to it. As far as it's a no vote, the board will always be able to decide what happens to those funds.
So if they want to get rid of their own ambiguity, that's their path to it, is to stay in Social Security. And there isn't a redo on that vote at some point or under certain circumstances in the future.
By law, do a revote. We highly discourage having to do revotes because employees will want to pack that little bit of retirement for a minute. I'm gonna go for a year or two and invest, have more go to my retirement, and then I'll just come back in 2 years and we'll revote. So when we do the educational meetings, we try and let employees know this is your one shot of making that vote count. So they don't already have that in their mind of, I'll just vote again in a couple of years and then change this up. So we try and make sure they understand this is their moment to make that decision.
So I guess it's a lot to think about, big changes. I wish the counties had this option. How come we don't have the option?
So they became part of the federal agreement back in the 50s. And once an
Okay.
agreement is created, it cannot be terminated. So most people were not working in the 50s, so they were part of the process.
But I'm like, personally, man, I'm maxing out my 401s as much as I can.
All I get older. Take that time back. Well, I think, the consensus, I don't know, about the rest, the option 3, we're not even considering, right? I've asked the board, is there,
The nationwide one?
no, the option 3, putting it in the operating, we want to take care of the employees. Yeah, so don't even work on that. Okay, I got that feel anyway, that the employees are important.
So it sounds like the primary first choices would be either the Percy Choice 401k, or the match, the 401k match.
And I would take the bottom one, off the 3 clear off.
I got a big X through it.
If I could say something, I mean, I'm guessing the county employees that I work with would pick option one of those two. Just, you ask them, that's one they would pick, because the thing I constantly hear is I can't eat my retirement or benefits. And that's what I think if you survey the employees of Boise County, they'll pick option one. I don't know here, but I'd like to see that.
And I agree 100% on that, you know, what we've had is employees come in and say, I gotta reduce my contribution this month because I got this bill, whatever it is. And it makes an issue for payroll to keep up with that.
Right. The only advantage would be those younger employees who don't have social security credits into the system, that you build credits over time in terms of being able to X number of quarters and actually qualify down the road. So there would be that advantage in that regard.
What do you need? 40? What is that?
Yeah, I think it's 40.
40 pay periods in order to be
40 quarters.
40 quarters.
Yeah, it's a long period of time.
Yeah.
And then one other question, it was like 90% have to cast a ballot for this, it's an automatic no vote.
50% plus one,
Yeah.
Is that what it is? Okay.
Employees.
That's it.
who are part of it as of April 1st.
Okay.
Employees who are part of the vote.
And if you don't vote, it's counted as a no vote. So it is counted whether you vote or not. It's 50 plus one of the total eligible.
So is that vote gonna be like online or is it a mail out or how's
I'll
that?
mail it out.
Okay, so we'll be getting one of those here.
Okay,
Sure.
That it's a no vote if they don't vote.
Yeah, I found that interesting too.
The other way.
Okay, anything else on this?
One last, so if they voted to opt out of Social Security and chose option one, then at retirement, they're really on their own. And when that happens, people generally aren't really on their own. They're
On you.
on somebody else at some point. And as much as a lot of folks would want to live in the moment, we could be contributing to a bit of an issue, you know, especially with the way they're talking about social Medicare solvency and so forth right now.
All of our employees will still have their normal per seat. This is the contribution on top of that. So many of our employees aren't selecting one of these or planning to move off the system in retirement. I think Percy's still, this is, of course, adds a lot more comfort, but yeah, it's not the
totality of it.
yeah, not the totality.
Hey, any more questions or concerns?
I have one clarifying point. Would you like information from the employees before the next meeting, before the board makes its
I think
decision?
that would be helpful
Yes.
to just get the lay of the land, because we're making a decision that affects hundreds of people, but
Right.
And with that, would you like it just asked, would they like it directly or contributed to their retirement, just between those two options?
Yeah, I think that's
Yeah.
a fair question.
I do too.
They could take it back as salary or they can take it in retirement. I think that's a real fair question.
Make it simple.
Make it
Yeah,
simple.
because-
Yeah.
With the understanding that the salary is going to come with the tax obligations to
Right.
it. And
full
For
size.
that.
I don't see, yeah, full
and then I'll run the pool on how the vote outcome.
How much is it gonna cost to get into the?
We'll figure that out offline.
It'd be May Madness instead of March Madness.
Right.
Okay, Rachel or Jackie, you have anything else you want to add to this?
If you have any questions come up in between, we're happy to answer.
Thank you both for being here too, by the way. Thank you. Okay, we're gonna move on then. Our next agenda item is the director's report. Wait a minute, I just skipped something. Hold on, stop. Review and discuss the FY 24 financial report. Laura, I'm assuming that's you.
That's me.
Sorry about that.
Ready to take a break, but keep going.
Let's keep going.
Hey, Dustin, if you can pull the presentation up, please, the budget to actual. We will start on page 1. And this get through pretty quickly. So report is through the end of March, which is 75% of the way through the fiscal year. So you can look at our total numbers and see where we're at with our revenues and expenditures. Revenues are coming in at 81% of our planned budget. So ahead of track on revenues, and our expenditures are coming in at 71% of our planned budget. So the line where we plan to be for expenditures, which has been our pattern throughout this fiscal year. If we are looking at the revenues at the top set of rows, total fees are coming in at 74% of budget. Contracts are coming in at 60% of the budget. And you saw that in Russ's budget presentation too, that some of the funds that were originally planned as contracts, namely the opioid funds, should have been categorized in the other category. So we plan to receive them in contracts. When we receive them, we categorize them appropriately in other. So you see that discrepancy between contracts being under and other being over in both of those columns. The contracts that are showing in admin and support services that we had not planned for at the beginning of the budget year from the infrastructure grant we received from the state. And then looking at our other expenditures, you can see we're way over planned amounts, and that is of all those opioid funds, which are restricted funds set aside for future years spending, and we'll talk about that as we move through the budget. For expenditures, same trends we've been seeing. Personnel's at 70% of planned budget. Operating still a little bit under 72%. Capital outlay went up this month to 128% of planned budget. The primary reason for that was some HVAC repairs, and then we upgraded the technology in our meeting rooms throughout this building and in Mountain Home and McCall to Teams rooms like this, so that all of our outlying offices have the same technology that we do, the ability to connect. We had in some of our offices, we were still going through some of our trainings using old VCR TV combos, and really wanted to give them the opportunity to have the same access to technology that we have in the office here.
They can attest the HVAC is working. It's cold.
Jack, you should be. That's always cool. Okay.
Moving on to page 2. So this shows our comparison over the past 2 fiscal years. Our fees are slightly behind where they were last year for our community environmental health, and just in the past month, our family and clinic services fees have moved up in comparison to where they were last year. But as we looked at in the fees for next budget year, our fees have been pretty straight line, pretty flat, little ups and downs, but generally staying pretty consistent with our fees that are coming in. And for contracts, we're comparable to where we were in FY22, and showing a little bit of a, well, not a little bit, showing decrease from FY23 to FY24. And that's just variation in which contracts we receive. And again, some of those, that still reflects some of those that we received in as contracts last year, the opioid funds that should have been in the other category. Our personnel costs, as we looked at on the first page, are under budget by about 9.5%. Operating costs under by 3.5%. And then our T&B and capital outlay both slightly over, well, T&B a little bit over planned amount, and for our capital outlay because of those upgrades we just talked about. There. Then on to page 3, our cash balance statement. Same as last month, cash balance statement shows a total cash balance of just over 10 million. Most of that's allocated to either restricted or designated. As we've been discussing special projects, the van purchase allocation will remain untouched going into the next month. Employee retention maintains being completely paid out. And then the environmental health system upgrades, we have our bid package put together. We'll be going out to bid next week on that. We have done demo calls now with 3 different vendors, all had fantastic products. So we'll let them know when our bid is posted on the website. Potentially a couple of other vendors too, but the 3 that we talked to would all meet and surpass our needs and be a significant upgrade from what we have now. Cloud-based services, just ability to do the full life cycle application, inspection, permitting, renewal process in one application. So some really cool products out there. Yeah, we looked at what City of Boise, City Meridian are using. That's will be one of the primary bidders. So we're really excited to be able to move forward on that. I know it's just looking like a very small amount of expenditure so far. Those have just been our internal meetings that we've had for those demo calls. And not sure if we'll be able to get the bid in place and if you'll see payment out of this before the end of the fiscal year. We're hoping to be able to move fast enough for that, but depending on when the contract moves through and when first payments happen, it may or may not be before the end of this fiscal year. But fingers crossed on that. So that is a total of $367,000 that we had allocated in special projects. Personnel reserve remains unchanged. Operational reserve and capital reserve also remain unchanged, bringing us to a total reserve fund designation of almost $6 million. Restricted funds of $4.2 million. That includes what we talked about in the budget prep, any funds that we've received that are set aside for future years, and anything that's just set aside for specific purposes but isn't in the active budget now is in that category. Which leaves us with a cash balance undesignated and unrestricted of $332,000.
Laura, quick question on the construction projects.
Yeah.
Do they have to be public works licensed to work on our facilities? You know?
I think so, but I don't know the answer to that. No.
The reason I bring that up because it used to be 50,000. Anything over 50,000 had to be by a public works license.
I'll look into
Contract.
that for you.
They've raised that to 100,000.
Okay.
And that started this year. That came through the legislature as well, which really helps out county projects. We don't have to have a public works person for those smaller projects, which means you can hire full-time to do that work. Or before that was an issue. But if you can find that out, I think that's kind of something I'm assuming we would have. Anything over 100,000 would have.
I will find it out.
So are you saying then it's less expensive to hire someone that's
Absolutely.
quite a bit less expensive?
And you get a lot more bids on those smaller projects.
Yeah.
There's up.
Yeah.
Like the process and expense for
Huge process. Okay, this is not an action item, but is there any questions on this? Okay, we're all good. Then we're gonna move on down to our next agenda item, the director's report. Mr. Duke.
Thank you, Chairman Hasbrook. So we talked about the budget committee meeting and the board meeting on May 10th at our McCall office. It'll start at 10 a.m. Then we do have a special meeting on April 25th. It'll be here in this room starting at 8:30.
25 or 26.
Oh, I probably wrote down the wrong number.
It's the Thursday, the 25th.
Thursday,
Thursday.
25th. Okay.
I got it right.
Okay, thank you.
Partially.
25th, 8:30.
It's the 26th.
All right.
And I'm assuming most are gonna zoom in on that.
Yes.
I know I will be. I don't wanna have to drive all the way down here. There's an hour and a half meetings, so we'll probably zoom in. Appreciate everybody being at that. That is an executive on our current issues. Or if everybody show up for that.
It's Thursday, the 25th.
8:30.
That's it.
And have you sent out a link yet?
Up and out.
That'd be great.
It's
Okay.
not in your appointment. I thought you talked to.
So the last thing I have is I wanted to share with all of you. I got a letter from East Boise County Ambulance District. And I often get letters, at least the ones I want to read to all of you. But this one is. So this came from the Director of Operations, Mary Adams. And it says, the purpose of this correspondence is to bring to your attention the commendable performance of two of your employees, Courtney Boyce and Jessica Harris. And you met Courtney at the last meeting. She's our substance use program manager, and Jessica works with her. On March 14th, 2024, Courtney and Jessica provided in-service continuing education training regarding overdose response for EMTs at the ambulance district. They are the sole emergency medical response and transport provider in the 1,907 square mile portion of East Boise County. As the first responders to overdose emergencies, the training provided to the district by Courtney and Jessica was very timely. Both were clearly subject matter experts in this area and seemed to genuinely care about making a positive difference in the lives of Boise County residents. They both delivered a presentation in a concise, easy to understand manner. More importantly, they didn't just stop at delivering a presentation of their curriculum. Both discussed resource options for the district available from CDH, including grant fund availability and naloxone distribution options, which the district is hoping to partner with the CDH in the future. Courtney and Jessica were passionate about collaborating with the district and discussing the unique problems of rural emergency response and harm reduction in the community. They represented CDH in the most professional manner. They exhibited leadership traits and skills that, in the end, reflected most favorably upon CDH's mission of promoting and protecting health in Boise County. Their diligence was such that I felt compelled to reduce to writing the efforts of Courtney and Jessica and to personally bring them to your attention.
Very nice.
And have they been made aware of this?
Courtney has and Jessica will. I'm going to meet with them at their health promotion, health policy team meeting and read it so the whole team can hear it. But pretty cool.
Yeah, and the EMS district are having a hard time right now. You know, in our county, we're going for a $4 million override to try and get them for funding, but it's been a challenge.
I'll jump on that bandwagon. I've come over a couple of times now for a couple of classes, like Stop the Bleed and another one the other day. And both of the trainers did a phenomenal job. And I'm afflicted with this hockey addiction and have season tickets. And I ran into a couple of really nice young ladies working the CDH booth and doing educational training at the hockey games. I stopped and talked with them for 5 minutes or something, and they were both really engaging and educational. I kind of watched their interactions with the crowd and or as people walk by. And so, you know, it's really encouraging to see a lot of, you know, folks on the payroll doing good stuff.
Yeah, thanks for saying hello to them. I'm sure they appreciated that.
Okay, anything else?
That's all I have.
No, that's good news. It's all good news.
That's all I have.
That's all you have. Okay, is there anyone in the public that has any comments? Either online or in the audience? Okay, there being none, thanks everybody for showing up today. Quick meeting. This meeting is adjourned.
Thank you all.
Good job.
So you guys know, I didn't want to repeat this loud.